This is coming at a good time. In the last 5 months, more than $30 trillion in wealth has disappeared globally. That is well over twice America's annual GDP and a little over half the world's annual GDP. So the question is, can we continue to count on philanthropy and corporate giving to the extent we have seen it in the last few years? And if it is going to continue, how can it be done in the way that is most effective, that saves the largest number of lives? And in particular, since you're here on the global public health agenda, and I want to commend you for these special papers that were put out by ECOSOC. They're both very, very good. How will we go about doing this? I would just like to offer a few observations. In the last decade, we have seen, more or less parallel with the rise of democracy and the rise of vast private fortunes in finance, a staggering increase in NGO activity. In the United States, there are now more than 1 million foundations. Half of them started in this decade. More than 500,000 active in India. About 400,000 registered in China, perhaps many more than that unregistered. The NGO movement in developed and developing countries alike is exploding. It arose, I think, in no small measure because of a confluence of factors, but the most important is that I think we all recognize there will always be a gap between what the private economy will produce and what government policy can solve, and civil society needs to step into that gap. And secondly, when there is a high level of cooperation at the local level, it is possible for NGOs to do a lot of this work more quickly and in a less costly fashion than would otherwise be the case. So when we think about where we're going from here, particularly in the area of global health, we should think about what kind of philanthropy we mean. And philanthropy is simply giving. Are we giving money? Are we giving time? Are we giving skills? Are we doing it in partnership with local governments? Are we doing it in partnership with local NGOs? There are serious questions to be asked and answered. But let's begin by acknowledging that as far away as we remain from reaching the Millennium Development Goals in maternal and child health and in untreated tropical diseases especially, there has been a staggering amount of progress made in this decade. And part of it is from the concentration of donor efforts, public and private, through the Global Fund, through Gavi, through GAIN, through the Drugs for Neglected Tropical Diseases Initiative, Malaria No More, through UNTV, which I have the honor of working with. And so the question is, can we sustain what we're doing? And we know we have to do more. How will we do more in a difficult time? And what arguments will we make, or devices will we use to broaden the number of people who are a part of this philanthropic community? First, let's talk about giving, and giving from the private sector. Part of it is money, part of it is organizational skills, part of it may be materials. But I think the most important thing I'd like to say is that I expect that much philanthropic activity will have to be financed in a different way going forward, and that there will be a financial restructuring in the NGO movement that roughly parallels the restructuring of financing of the regular economies in a lot of wealthy countries that have suffered financial collapse, and that parallels the restructuring of political financing in my country. where we've been through several cycles now where internet donations that amount to a lot of money, even though individually they're relatively small, have become more and more important. But in the history of this, the three most important internet campaigns have been the three that were most prominent this year: President Obama's, Hillary's,